All right, so I'm Fiona Miller, as you know. I am not Jay Shaw. He apologizes. He's been quite unwell the last few days, but I'm really privileged to take over this panel, particularly when colleagues have done all the work to put it together, to put together an amazing discussion with these brilliant people over here who are talking to each other and will soon talk to us. On this really important and challenging set of issues around the climate costs of AI. Of course, it's not just climate. There's a broader set of ecological questions here, and there's a broader set of questions about the impacts on our health and the impacts on our health systems and the impacts on the planet, both positive and negative, from the growing quantities of data, the growing sophistication in the management of data. Health data is not the only category of data, but it's one of the rapidly growing categories of data that need to be stored, that are being manipulated in increasingly sophisticated ways, and maybe we'll talk about whether the phrase AI is an adequate or inadequate way of capturing all those sophisticated data analytic approaches, but certainly raising really critical questions for us in the health space and healthcare space, where we hope to get some real benefits out of the sophisticated capacity to mobilize and manipulate the data that we increasingly can collect. But also the questions about the planet that arise therefrom. So with that, I am going to introduce our three speakers. And I'm going to just note that they will each speak in turn. We'll do the Q&A afterwards. We should have time for almost a half an hour of questions. So I'm really hoping that we'll be able to have a pretty vigorous discussion. I certainly plan to ask some tough questions of my esteemed colleagues here. But let me start by just introducing them first. The first person who's going to speak is Dr. Chris McIntosh, who's a scientist at the Toronto General Hospital Research Institute and also an assistant professor at U of T, who holds appointments in multiple departments: medical biophysics, computer science, medical imaging, and also holds a joint research chair in medical imaging and AI. And his research is really very focused on the theory and the clinical application of AI in medicine. We also have Dr. Bettina Kemme, a professor. I'm hoping, the grimace was, I hope I got that right. I've asked her twice now whether I got that right. A professor in the School of Computer Science at McGill University, where she leads the Distributed Information Systems Lab. Her research interests are in large-scale data management and distributed computing, with recent projects in graph-based database management and sustainability aspects of data science. And finally, Dr. Mamdani, who's the VP of Data Science and Advanced Analytics at Unity Health Toronto, also director of the University of Toronto Tamardy Faculty of Medicine Centre for AI, Research and Education in Medicine, or TCARM. Also a professor, of course, at U of T, and his team works to bridge advanced analytics, including machine learning, with clinical management decision-making to improve patient outcomes and hospital efficiency. So as you can see, we really have a star-studded team of experts to help us to think through these critical issues. So I'm going to hand it over to Chris first.
Great. So thank you, everyone, for having me today. So today I'm here to talk about some of the not-so-hidden costs of AI in healthcare. This will be probably a little bit controversial because I don't agree with a lot of the other kind of assumptions about costs, and so let's go through. So I'll start off with just kind of a very high level of what a lot of the modern AI is and how it works. So a lot of you are kind of familiar with perhaps these single image models. So this is what I would say prior to ChatGPT, this was like 90% of AI work. And so the idea is you would take either an X-ray or an image of a cat or a dog or whatever the thing was, it's just a two-dimensional image to a computer, you punch it through a deep learning model, and out comes this vector. And that vector could be a vector of probabilities, saying this has a 10% chance of the patient being sick versus a 90% chance of them being healthy, or 50% cat, 20% dog, all these sorts of things. And this we did for many, many years. And then more modernly, you might be familiar with this kind of setup here. So this is just a screenshot from ChatGPT. And so inside you can see an X-ray going in, and then I've asked a question, what is this an X-ray of? So the image is called like the vision input. The question in this case is text. So those are two different modalities. And then on the bottom, it's given an answer that I am not a medical person, and so I'm just going to assume is correct. And if there's any actual radiologists in the room, then please disagree with ChatGPT, not me. And the idea is that it's actually kind of tricky, because looking at it this way, you're like, well, it's reading an image. Kind of. It actually thinks of the image as text. That's how ChatGPT processes an image when you put it in and ask it, what the picture is. And so how does that work? Well, if the slide, there it goes. How that works is that we actually go back one a little bit here, and we think of turning it into that vector. And so the image goes through a model, not unlike the standard deep learning image model that we had before, and a vector comes out, but instead of a vector of probabilities of it being cat versus dog, healthy versus sick, it's just a vector of numbers. So the first one's going to be the number 75, the next one's going to be the number 462, just a bunch of numbers. And then ChatGPT learns that 75 followed by 62 followed by 30 maps to X-ray, and 75 followed by 20 followed by 100 maps to dog. It kind of, I know that sounds complex, but it's really that simple in a way. And then it turns out that we can actually, so this is from a recent paper from my group, that we can do this for then multiple modalities. So we can turn X-rays into these kind of like text representations, you could think of them as. We can turn ECGs into them. And then we compare them with large language models like ChatGPT so that we can build these models that understand different medical representations of data. So why is this relevant? Well, when we look at large language models, this is often what we think of doing things like, for example, 30-day readmission prediction. So what we did here is we actually compared our model using text only versus using text and images, text and ECGs. And it's very, very nerdy, but at the end of the day, we see the numbers go up, and so we're really happy. And there's this question of, is this worth the carbon cost? That's what we're here, essentially today to ask, is my job worth the carbon cost that it produces? And I'm going to argue yes, since I'd like to have a job. So let's kind of go forward, and we'll ignore the model's numbers going up. That doesn't really matter. So what is the carbon cost of training an AI model? So this is a graph, a little bit old, because OpenAI is no longer open. They're actually a for-profit company. They've been restructured as of this year, so they don't tell us the cost of training GPT-5, but when they were actually OpenAI, a nonprofit, they told us the cost of training GPT-3. So here we have it in terms of CO2 equivalent emissions in tons, so it's 502 tons to train GPT-3. We can imagine it's an order of magnitude higher for GPT-5. That's sort of expected. And this seems like a very, very big number, and it is a big number, but I'm going to explore the other side of this for a minute. So where is the actual cost, right? That was the 500. And so now let's think of like a state-of-the-art medical model, so like one of my models here that I'm going to pick on, because it's easy to pick on myself. Well, remember, we first have to acquire all these different types of data. And so this is the carbon cost of imaging from a paper from a few years ago. And so if we look in here, we have there's 0.5 kilograms of CO2 emissions corresponding to driving a modern car. A CT scan is 9.2 kilograms for just one chest CT. A resting MRI is 17.5 kilograms of CO2. So that includes, building the MRI machine, all the power involved in actually acquiring the image, destroying the magnet afterwards, et cetera, et cetera. So it's a very large number. And so let's do some simple math on this to train a model. So these are kind of the numbers that are roughly what we would use to train a state-of-the-art AI model. So we use 400,000 X-rays. That's 13,000 kilograms there just to acquire the X-rays. 30,000 CTs, that's 276,000 kilograms to acquire those CTs. 525,000 kilograms to acquire the 30,000 MRI. We didn't even account for the patients traveling to the hospital and all the other employees traveling to the hospital to acquire all of this data yet. And we're up to 814,000, so 800 tons more, and then training the model. So we've actually already greatly exceeded what we thought was a really big number of 500 for ChatGPT. And we haven't trained the model yet, we've just acquired the data. So now let's look at one other piece of this puzzle. So the other piece of this puzzle is inference itself. And so in this graph from a paper from 2024, it shows the cost of doing inference for various tasks. And I don't know if the mouse pointer is gonna, nope, I'm gonna walk. So, and my voice is massive, you'll still hear me anyway. So you see text classification there on the side, that's actually very, very small. So that's asking ChatGPT, is this sentence happy or sad? Not quite ChatGPT, but a smaller model. Mass language modeling, so that's finding missing words in a sentence. We're kind of starting to go up. Image classification, we did a big jump there, so that's telling the image is a cat or a dog. Object detection, now I have to do these things self-driving cars. So effectively what I do is I take an image classifier, I look at this entire room in front of me, and I pan the image classifier across the entire room. And I run it many, many thousands of times, once for any little area of the room, and I do something as simple as, is there a face, is there a face, is there a face, is there a face, yes, 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 no, no, no. And I do the detection. Oh.
Actually, don't.
And so,
There we go. Bettina's got the one that works.
oh, people with technical skills. There we go. Okay, so then we have multitask extractive QA. So very, very similar. Again, we're just trying to do kind of quality assurance. Text generation. So now we're getting kind of up a little bit higher. And we'll sort of go image captioning. So that's taking an image. I have to understand the image and write text under it. That's getting closer to ChatGPT. And then if we keep going over, what do we see way up in the top right-hand corner? A good, what is that, 1,000 times more, if you look at the y-axis there, right? So that's 1,000 grams of CO2 per image generation in comparison to the mere 2 grams for the text classification. So image generation is, you know, asking ChatGPT, hey, which I admittedly do all the time, can you give me a cool black and white drawing of a princess? My daughter would like to color it. And so that apparently is actually a ton of carbon. And now when you start to think of, okay, well what do people actually want to do with these generation models? They don't want to generate an image, they want to generate video. And so this was a 2024 paper when we weren't doing much video generation, but you imagine this paper from 2025. Well, a video is 30 frames per second roughly of image generation. So that means 1 second of video is 30 times that number. And an hour of video is then, you know, 60 squared and going up and up and up and up and up. And so we can start to see the cost of inference is actually extremely high in these models. And so let's do some basic extensions of math to the medical domain. So, okay, I want to do inference on all the CT scans in a year in Canada. That seems like not an unreasonable thing to try and do if we're going to build all these CT-based AIs. Okay, so there's about 6.3 million CT scans per year in Canada. That equates to 58,000 tons of CO2 just getting the CT scans, right? But we're going to include that in the cost of inference, and we had to do the CT to be able to do inference on the CT. And then the inference is 7.5 grams. That's the cost of doing inference on a 2D image that we had from the previous slide, times the 256 slices within a CT. We're going to average that a chest CT is about 256 slices. That more or less works out. So that works out to be about 12,000 tons of CO2, which is enough to train GPT-3 20 times. So we had a 100-time multiple of GPT-3 in acquiring the data, and then a 20x multiple in doing inference on the actual data. So I kind of put this question back, is the thing that we should be afraid of training models? Or is the thing we should actually be afraid of running the models, the legacy of what these models mean? And so maybe we should stop building models if we're not going to run them. But then I'll play devil's advocate a little bit more. Well, what if AI could avoid readmissions? So here, okay, we're 75% accurate, which, you know, is reasonable. Maybe that could sort of kind of help. But imagine this number was 90%. And all of a sudden, we're avoiding people coming back into the hospital for urgent care, avoiding more chest CTs, et cetera. And so I would actually argue that if we can make these models good, we can actually use them less, acquire less data, avoid less readmissions, et cetera, and therefore avoid carbon, despite the fact that the costs initially seem staggeringly high. Thank you.
Okay, I'm very glad to be here. I want to say I'm a core computer science person, no healthcare background actually at all, but over the last couple of years I have been looking at a more systematic approach to understand sustainability in machine learning and data science. So, and Obviously, you have probably all seen this in news, and we had seen this here also as an introduction. There's tons of news about it, like that the electricity demand just soars because of AI. It's poised to drive all our increase in demand in the data centers. On the other hand, you have things like, well, actually, you know, let ChatGPT do it. It's actually more energy efficient than if you do it by hand. So you get all controversy here. You get also here an example, the International Energy Agency has to one hand said data centers account for 3% of the electricity demand growth, but then on the other hand, in the US, data centers account for almost 50% of the electricity demand, which also shows that where data centers are, where the AI happens, is definitely also geographically focused on some regions. And I think we also have to take this a little bit into account. I have seen it in other talks today. But what does this mean for me as a researcher in computer science? And I'm not in machine learning actually, but I'm a software person that builds the platforms that help these machine learning systems to run. So I believe that we researchers, machine learning researchers, but also some who use existing machine learning techniques in their applications, for example, in health, to be energy and carbon aware. We have to understand the concept behind it, because then we can do a proper trade-off analysis whether it's worth doing that kind of research or not. And once we have a good understanding of it, then we can also, this will also help us to develop solutions that are lower in carbon emissions. So what we know, and I use a terminology might be different than my colleagues use, so I want to shortly introduce this. What I call effectiveness is how good is your machine learning model. This is how good does it predict whatever it's supposed to predict. And they're obviously the bigger is better, and we have seen a couple of numbers on Chris's talk that go between 0 and 100. And whether it's could depend on many things, model size, the better your bigger your model, typically the better it is. Input data, the more data you have, the better your predictions are, the model architecture, and then more specific machine learning aspects. But I come more from the systems community, and we look at efficiency. We look at what is our computational cost for that. And typically we work with runtime. How long does it take the model to run? And obviously we want the faster it is, the better it is. And that depends on exactly the same things as before. Now here it's just like the bigger the model, the longer it runs. The more data we have, the longer it runs, et cetera, et cetera. So we have to understand it, but we also have another component, and that's the computer. If you have a small computer, it takes longer. If you have a bigger computer, it goes faster. But we also need to, and how much energy does these computers need when they do these computations? And people have not yet looked a lot into this. So we have the figures that he showed are from Sasha Luciano, who's one of the trailblazers in doing these analytics. But if you look at your standard machine learning researchers, they don't do a lot of analysis of that. So what we try to do is to do a more systematic approach, and I want to just go here into what I understand in emissions and energy. So when we look at runtime, when you run an algorithm, it draws power, and over time, it uses energy. And that is typically joules, kilowatt hours, etc. In carbon emission, you multiply this by this carbon intensity factor, and that one issue is, and therefore I always have a little bit of a problem with these numbers in CO2 emissions, that is both location and time dependent. So if you're in Ontario this Monday, at 3 p.m. and you run your algorithm, this intensity factor is 130, but if you had run the algorithm at the same time in Quebec, this multiplier would have only been 54. So we have to be also aware of this number is very volatile. And then when we do this computer, it's not only the computer, when you run the algorithm, obviously computers have to be produced, have to be on waste again, so we have to consider the whole life cycle of it. And if you now do it, so what is then the cost of the ML task? It's not only during runtime, but you also have to take the amortized cost over the embodied carbon that considers the entire life cycle. So then what we have to look at carbon emissions of data, and Chris has talked about it a lot, so that's awesome. And I found this also very inspiring because we computer scientists ignore that completely. So it's a really big insight for me. And from there, so what is this effectiveness efficiency trade-off? And so what has happened over time is that if you see on the x-axis AI performance, so your prediction got better and better, but your computational cost also got bigger and bigger. Because the bigger your model, the longer you have to run, the more energy you use, and so you see this trend. So you consider this a trade-off. Less AI performance, less computational cost. What is more important for me? And what we tried in our work, for example, to put this into a better cost function. So when researchers develop their next cool algorithm, or if they compare different approaches with each other and they say, mine is better, they always say, I have better AI performance. But what is if we also take computational and energy costs into account? We have to kind of provide a cost matrix for that. So, in a very simplified form, we want to both decrease computational cost and increase accuracy in prediction. So basically decrease the inverse of the A performance. So if we have a cost model that we can also, for example, present in our research papers when we compare approaches, and we have different methods that we compare, and then we can see, well, if you are more interested in computational cost and energy savings, we should take method 1 because that has the lowest cost. But if you are more important when effectiveness like AI performance is really crucial, then maybe method 3 is the best because it has the lowest cost. And if you want to have some balance in there, then actually method 2 is the different cost. This would allow us to better understand the trade-offs of the different methods that we currently have. The second thing is then the objectives. Well, currently we develop new machine learning algorithms, and we have here this trade-off cost. But what about not having any trade-off at all? So what we then have to do is that we have to try to be in this quarter here, because that means, well, compared to what is out there, we aim at better AI performance, but without extra computational cost. Or we aim in the same AI performance than our competitors, but we have less computational cost. Or even better, we have better AI performance with less energy cost. So this is kind of where we should strive to. And so in the research community, we have been working on this, and finally, it's not so much the people in the machine learning community that work on it, but my community where we work on systems, these platforms, these pipelines that run these machine learning algorithms. And so we tried to find these, and the first one come actually here, change the carbon emissions of your data. That would help. But then what comes more from the computer science community, so if you look at the hardware providers, we say we provide you better hardware. So NVIDIA is the big GPU provider on which these machine learning algorithms run, and they say, look, in 2016 you did one inference, cost you 17,000 joules, but now it costs you only 0.4 joules. Problem solved. Problem is that this more efficient hardware that goes in a really rapid space isn't so much helping because of Jevons paradigm. As soon as you have the more efficient hardware, you have bigger models. You do more computation. You grab everything. You do now an inference for every Google search that you do. So it's like, you build a new highway, it's packed with cars, you get new hardware. Here, it's packed with more stuff, with more computation. And the second one is the replacement cycle. If there's a new hardware every half a year, if I throw out the old one, well, my embodied carbon footprint is super huge, and then I don't save on it because the production of this hardware has been so expensive. So you have to look for other solutions additionally, and we have been working just one slide in the ideas, well, you have your hardware, that it is, but it turns out that when you run these algorithms, they do not always need the full power that is provided to them. So we are looking into it, at what moments, oh, you don't see it, at what moments in the runtime of your execution you actually do not need all the power, and in those moments we go down with the power, so we use less energy, but the system from the outside has the same thing, same runtime, same performance, etc., but actually less energy. Obviously, that sounds easy. Our students are busy but doing this right. Another one is infrastructure aware. I mentioned that these carbon emissions are actually depending on time. And so typically if you have solar engine, it goes down, it goes up, it goes down. Maybe you can do a scheduling of your heavy machine learning tasks at the time where the data centers have low emissions. So that's also a very nice idea. And some people, and I have seen a talk from Meta where they are doing this. But obviously, so what do you do with your computers the time where the emissions are high? And also, how do you fit all your tasks in those few time spots where the efficiency might be low? Another one is make sure that you really use all the hardware that you have. Don't throw away the old one. Use it for things that don't need so much power. Another one is here, if you have several models and you have a requirement of how good your prediction have to be, choose the one that provides you with this prediction but using the least amount of energy. And obviously then there's a lot of work, and I don't go into this one, where the machine learning community tries to make these algorithms themselves more efficient, and I don't bring them here. But as a summary, I want to say, when you develop a new machine learning algorithm, or you in your research decide to use machine learning algorithms, don't only report about AI performance, report also on resource consumption, measure it, discuss the trade-off, present the trade-off and discuss it, because that will be the basis to say, is it worth having this new algorithm? Is it really so much better in terms of AI performance that it's valid the extra energy consumption? Or even put the dual objective in that you have less computational cost and better AI performance. And one other thing, and I just put it in now because I saw a lot about talk of it. I'm a computer scientist, so I'm a little bubble. This is here my super outreach to health. But it's aware that we IT geeks cannot just talk by ourselves. Being in our bubble, we obviously have to reach out. I think in questions of AI and fairness, a lot already has happened. But in terms of AI and sustainability, I think there's a long way to go to connect with the right people to do the right decisions. Thank you.
Hi, everyone. How many people are here from a clinical background? Okay, fantastic, quite a few. How many more from a data science, computer science background? Okay, fewer than I thought. All right, very good. So I'm going to talk a little bit more about the clinical side of things and picking up on that point around trade-offs, because I think that's what it's really essentially going to come down to. There's a lot of interest in AI these days, as you know, and I'm not going to belabor this point because we've seen it. The interest in incorporating machine learning has been growing exponentially in terms of literature, in terms of the research that we do. We've seen many more solutions that are US FDA approved that incorporate machine learning into their devices, and this is again growing exponentially, where there are now well over 1,000 US FDA approved devices with machine learning incorporated into them. What this basically means is that this research, at least some of it, is being translated into meaningful things. Now, of course, one will argue 80 to 90% of this is nonsense, but there's actually quite a few that are actually pretty legitimately good. And then, of course, why is all this happening? It's because of money. People are driven by money. The amount that's being spent on AI these days is pretty impressive. The market size for AI intelligence in healthcare from 2023 to 2034, it was about $20 billion 2 years ago. It's expected to go up to over $500 billion in less than 10 years. So there's financial incentive around this. What about the impact? That's what I'm going to get people to think about. The issue here is, yes, okay, it impacts the environment, it impacts a lot of things, but what are we getting out of it? I'm going to pick on some success cases. There's a lot of failures, but I'm going to pick on things that I think actually have been impacting us in a meaningful way. The first is AI scribes. We know that our primary care docs especially, but a lot of docs in general, are really struggling with burnout. They're expected to do so much. And quite a bit of their work has gone to administrative tasks. So these sorts of things, what they do is they basically listen to the conversation between you and the patient. They transcribe stuff and they'll generate your medical note for you. It's not perfect, but it saves time. How much time does it save? Well, one of the issues is not only time, but cognitive load. When you're actually trying to focus on a patient, it's hard when you have to type half the time. So they've studied this, and the first AI scribe actually was developed here in Toronto. It was actually at our center when a family medicine resident came to us and said, "This is insane how we practice medicine. There's got to be a solution for this." So that's what we developed. Now there's quite a few companies that do this commercially, and the studies have suggested that 3/4 of participants, family doctors, nurse practitioners, report reduced cognitive load. They can actually focus on the patient and have a meaningful conversation with them. They save about 3 to 4 hours per week. And about 80% of them said, absolutely, this helps me. It gives me a bit more freedom. I'm going to continue using this. Now, there's going to be some carbon emission here. There's going to be some impacts on the environment. How many people think this is worth it? How many people think absolutely not, it's not worth it at all? Okay, I'm going to go through another use case. At our hospital in Toronto, we've developed something called ChartWatch. So this is an AI that's been used for about 5 years now. What this does is it monitors all of our patients. So we've deployed it in our internal medicine unit. It's now deployed in our general surgery unit, and it's deployed at St. Joseph's Hospital. What this algorithm does is it runs every hour on the hour. Every hour it's ingesting data, typically between 150 to 170 different data points, from labs, demographics, to vitals. And it predicts if somebody is going to die or go to the ICU in the next 48 hours. As soon as it reaches a high-risk threshold, it's automated to page the medical team, and our medical team has to come and see the patient within 1 hour being paged. And there's all sorts of care pathways. We published our paper in the Canadian Medical Association Journal last year, where we've seen a 26% reduction in unexpected mortality. So fewer people are dying. This has impacts on the environment. How many people think this is worth it? How many people think it's not worth it? Okay. I'll give you one more example. In the UK, they've developed and they've deployed actually an algorithm in 107 hospitals across the UK health system. It's around stroke detection and management. What the algorithm does is in just about 1 to 2 minutes, for every head CT that's done, you referred to the impact on head CTs, every head CT that's done, it runs through the algorithm, and in 1 to 2 minutes, it will tell you if the patient needs to be in the operating room right away or if they can be medically managed. And you can imagine this rapidly improves the care that you give the patient. What they reported out last month in Europe was they have said that the percentage of patients leaving the hospital with no or minimal disability increased from 16% to 48%. So this means patients are walking out of the hospital rather than being taken out in a wheelchair. How many people think this is worth it? How many people think it's not worth it? So where I'm going with all this, and there's other examples as well. You've heard of Neuralink. There are trials now in Canada where two patients have been implanted the Neuralink in their brain, where quadriplegic patients who can't move are given the ability to actually just use their minds to actually move a cursor on a computer, for example, to communicate. It's actually being now translated into speech, where people who can't talk, now they're able to actually express themselves because the Neuralink actually understands what they're trying to say. This is going to be life-changing for a lot of patients. Sorry, that was the other slide around the speech link. But then, of course, there's the other side. We have these data centers. They're power hungry. They consume a lot of energy. And what is that balance that we're going to have? Now, of course, there's a lot of nonsense we do too, right? We use compute because it's there. And we do it because it's there. Can we be a bit more thoughtful? Arguably, sure. Do we think about environmental impacts? I certainly haven't thought about it that much over the past little while. Just recently, I've been thinking a lot more about it because you see the intensity of these solutions. I was at a conference in Florida last year where there's somebody who actually does a lot of work internationally, and he was telling a story about his experience in South Korea, where in South Korea, the government had to make a decision because they were building some irrigation thing where they could divert water. But they had to make a decision around, am I going to divert water to farmers or am I going to divert water to our data center that needs cooling? They chose the data center. Now some will argue, wow, that's really sad. What if they're using it for those 3 or 4 examples that I just gave? They're trade-offs. I think the big question for us is the value. Most things in life have a trade-off, as was mentioned in the previous presentation. But what is that trade-off? And there's many people who will actually ask, what is the value in healthcare for the expenditures that we have? What are we getting out of it? What's the ROI? The reality is there's many pieces written on value. In fact, there was a European Commission that convened a group of experts for about a year to try and define value in healthcare. And the conclusion of the committee, expert committee across Europe, was that there is no universally accepted definition of value in healthcare. We don't know what it is. So we have to ask ourselves, what is it? Does it incorporate environmental considerations? It should. How do we do it? There are frameworks. And more people are actually trying to understand how we incorporate environmental impact into these frameworks. A common one from a health economic standpoint, and this is how some bodies make recommendations, is the incremental cost effectiveness ratio for, again, this is a health economic perspective, where what we try to quantify are the outcomes. Some of them are very intangible, but the costs that actually go into getting those outcomes. This ICER, which a lot of people use, doesn't really take into consideration environmental impact, but people who created this sort of stuff are now starting to think about how do we do it. Because at the end of the day, again, I think it's going to be about trade-offs and balances. And as a society, we're going to need to come together to try and understand how much of a hit are we going to take on the environment for the benefits that we'll get. And can we move more aggressively, not simply to AI, but responsible AI, where we're much more aware, we're much more literate, and we're much more thoughtful about the work that we do. And the work that we do is done in a responsible, meaningful way, understanding the impacts that we're going to have on things like the environment. Thank you.
Wow. So now I have the honor of trying to navigate some questions. So I'll wait for questions to come forward. Lots to talk about here. Maybe I want to start by picking up on the question that you've posed, Mohammed, about trade-offs, and ask you if you can think about this beyond the visible recipients of the benefits and beyond to the invisible recipients of the harm. One of the challenges I think that we grapple with around environmental issues, particularly in healthcare, is that we may be expending these resources polluting pharmaceuticals, energy-intensive data models, plastic-intensive care procedures, and we're doing it for the benefit of the patient in front of us, who is named, who is known, who is directly valued. And those consequences are generally nowhere near as clear, nowhere near as visible, nowhere near as named. And so when we think about, when you characterize a trade-off here between a health benefit and an environmental harm, some would argue there's a health harm attached to that environmental harm, but of course it's far less easy to track. It's not the same people, it's not the same place, it's not necessarily the same time scale. You, Mohammed, I put you on the spot, but it doesn't just have to be you. Others will have thoughts on that question, perhaps.
Yeah, I think it's going to boil down to hypotheticals versus actuals, right? There's going to be hypothetical harms to the health of individuals around the environmental impact that these high compute activities have. That being said, if we can't quantify them, we can't really have a meaningful conversation around the benefits that can be quantified. So I came up with numbers in terms of the clinical benefits, right? I think we need to come up with numbers around the environmental harms, and that's really hard to get at.
I'm sure we could estimate them. I wouldn't have them right here, but we certainly can if we know the, yeah, but fair point. So your response is let's actually put that in front of ourselves in an enumerated way and then have that conversation much more. Okay, thank you. Other thoughts on that one?
Yeah, beginning my thing was the same, and I mentioned a couple measurements. I omitted some because, you know, it gets more and more complex with the life cycle than how much a data center costs otherwise, etc. But so I would also be being a scientist saying we have to quantify it, and then we can, you know, weigh it, and we have. But we also have seen when we did our analysis that it's an apple and pear thing. Already environmental harm and benefit in terms of AI prediction, which, you know, you also in health have to translate into that's the health benefits. You know, I only, as a computer scientist, it's had 80% prediction accuracy. But what does this mean now for health? Becomes already a little bit harder, you know, to specify, and in the other direction, it's definitely even harder. So I think we also have to find a point where we say we stop and we realize now there are problems and they wait, even if we do not 100% quantify that. I saw just this morning was the keynote about this data center for cryptocurrency up in the north, and you know, all our numbers would calculate the PUE, et cetera, but they did not calculate that, you know, they blast chemicals that exist in the air around. I mean, nobody would, you know, quantify this anywhere in any brochure. So I think it is very, very hard, and we have to find a cut where we say this is now enough numbers, and we start the discussion around the numbers. Despite the fact that I'm one that says we should put up a cost function like that.
Right.
Yeah, I agree. I think the total costs are very difficult to assess. I mean, we published a paper quite a few years ago now, but we were looking at costs in terms of dollars, not carbon, but costs of some of these AI models to build and to train and to run. And one of the other sides of the equation that we had to look at was actually what is the cost of a life. And so there's all sorts of unquantifiable things in terms of, you know, emotional costs, but there's also the cost of, you know, if a clinician dies, then we have to retrain a clinician. And that has actual financial costs. There's loss to GDP. And so I imagine you could also try to calculate, as complex as it would be, like a carbon cost of, in Mohammed's models, like not only, you're right, there's that cost of inference, but if he didn't use the model, people would die. And then there's that, all of that associated carbon cost that goes on with that to try to balance what would eventually be this massive equation that seems impossible to do, but it'd be fun to try. That's a very good question. So a number of those come off of models that are open source. So we can run them in my lab. I can run them on an H100 or whatever, you know, recent NVIDIA hardware and kind of then directly measure. But you're absolutely right. Like for OpenAI, like that's why we were using GPT-3, because that's when we used to have actual code. We could look inside the box. But you're right, if they just report a number to us for GPT-5, they are somewhat inclined to report a different number than maybe reality, and it's impossible for us to truly estimate it, aside from trying to back engineer it, looking at their kind of profit loss statements and going, well, how much are they spending on electricity, and we know how much inference they're doing, and getting something complicated like that. So I think we right now rely entirely on the academic industry, but that is, to your point, a very big issue because the corporate industry in research has overtaken us in magnitude of what they can do. And so the amount of, the magnitude of the size of a model that Microsoft or NVIDIA or OpenAI can build in comparison to what I can do in my lab is, yeah, staggering. And so there could be some hidden costs that we just are unaware of.
Well, I want to mention that even in the academic setting, it's already difficult to get the numbers because they depend on the hardware that you have. If you have an H100 or you have an A100 GPU, the energy will already be different. And then you do the experiment in Ontario and Quebec, it is going to be different. So there are so many little parameters that can change the final number hugely, double, triple, etc. the numbers. So it's a rough game anyway, so we have to be aware of it. And therefore I say you have to do it to a certain amount, but then after that you have to start with other things than poor numbers that you put in. I want to mention that I think it's important for academia, nevertheless, to do it because we train the next generation of people who will afterwards be in NVIDIA and Amazon and Meta, etc., and will decide of whether they find this important or not important. And so now in the research, when you look at the machine learning conferences, they do not report these numbers as a standard factor. They just report about accuracy and goodness of the AI model. And so then they come out afterwards in industry and they don't care neither. And so I think from academic point of view, you have, even if you cannot compare or you know, compete with what is out in the industry, I think as trainers of the next generation of people who are out there, I think we have a big responsibility.
Maybe one thing I'll add around, is that better?
Yeah.
Yeah. Value is really tough. I do think that we do generally, I think, have at least subconsciously as a definition of value. The only problem is the application of it can be really, really messy. So for example, we have an algorithm that we use in our hemodialysis unit and these are patients with failed kidneys, really sick. They have a high 30-day admission rate. And we have an AI solution that generates a list of high-risk patients. So if the nephrologists and nurses have only limited time, they can focus on those patients and do more intensive management, so medication reviews, education, that sort of stuff. We've seen a 28% reduction in 30-day admission. You talk to a person in the United States for a healthcare system that is volume-driven. They'll never deploy it. Because if the patient doesn't come into the hospital, they don't make any money. So distortion of values, right? And imagine if we say we should be responsible and you talk to the owner of a data farm, they're going to downplay the environmental costs. They're going to upplay the profits. So that's where I struggle with, can we all align on the values? And maybe there's a certain kind of core of us that do, but it's going to be hard to get everyone to agree.
Yeah, I can start. So I know that, you know, I showed some models and perhaps we could avoid a CT, and you're 100% right. There absolutely would be scenarios where we would try to avoid it and people would want it anyway. And I think it would come down to what percentage of these sort of data acquisitions are driven by the standards of practice as opposed to patient driven. And I think those are the ones that we would have the original, initially at least the largest amount of impact at, because then we're not offering it to the patient initially. It's just no longer okay, you follow this up with a CT scan every 6 months. So the standard of practice becomes you follow this up with a CT scan every year, and at the 6 months mark we do an AI model and that kind of thing. And I think that would face reasonable adoption, but I'm also interested to hear from Mohan.
Yeah, no, it's a great question, and kind of the whole concept is a bit challenging because I think oftentimes what we do is we assume medical practice is perfect, and the AI then has to be perfect. And I don't think we do enough current state assessment, right? So I would argue, let's do a current state assessment to see how many CTs we do that are completely wastes of time, and how many CTs we should have done but we didn't do. I don't know if we really know. So I'll give you an example. There we go. When we were, well, let me actually make it short. So studies have shown that when we take a look at certain diagnoses, like for example, schizophrenia, over 50% of patients diagnosed with schizophrenia have been misdiagnosed. About 1 out of 3 asthma patients who have been diagnosed with asthma actually don't have asthma if you do proper spirometry and lung function tests. So, and we miss 10 to 20% of brain bleeds, intracerebral hemorrhages in typical emergency departments. So if your AI can actually do better than that, even if it makes some mistakes, I would argue it's well worth it. But if your AI is worse, then of course it's not worth it. But oftentimes we don't do that current state assessment. So maybe that extra CT is okay in the broad scheme of things. But if you don't do the current state assessment, you won't know. You're right. Maybe we're spending $5 million to solve a $20,000 problem, right? Which doesn't make sense. But I think right now we're in it so deep. It's not to say that it's justified. But I do think the potential to transform society is certainly there. A lot of these investments, because you can't tell the future, you have to make a leap of faith. And absolutely we're going to make mistakes. I'm not sure if this is a mistake. We don't know at this point, like honestly, because the amount of spend we have on this is pretty substantial. But the powers that be, especially the private sector, are seeing a lot of potential in this. What we're starting to see is the realization of these technologies in terms of actually benefiting society. So can I live without my Google Maps? Man, it's hard. I'll tell you, I use it all the time. Are we seeing the benefits for these examples? Yeah, we are. And I think we're going to see more and more benefits. What I worry about, though, is does it have to be $1 trillion? Could it have been 100 million? That I don't know. I see the value there. I just don't know if the investment is justified, if we can be more efficient.
So yeah, I think IT had a lot of waves and craziness, like around 2000 it was e-commerce, etc., and huge investments in it. It was not so much on sustainability there, the problem. And I think we are really right now in a hype, and it went crazy, but I believe that so obviously that, like, if everything, there's also a lot of danger. So in health, there's a lot of potential benefit, but there's also a lot of other areas where it's very threatening what is happening there. But I believe that if we work with the right tools, that we can bring the problematic things of sustainability. I truly believe that there are solutions to it, that you can have much more energy efficient solutions. Maybe still very expensive in terms of dollars, because you can make a lot of money, but in terms of energy efficiency, for sure, you can solve these things with much less energy if you really make this a high priority. And then I think, it bubbles right now, nobody thinks about it, everybody just thinks about the dollars, but if you put this in, I think then you can really take the benefits out. But you cannot just ignore sustainability here. I think you have to put it in right now.
Yeah, I mean, I think the other piece is that $1 trillion probably isn't that far off from the amount being invested in AI generally, but I think healthcare is a very small percentage of that. I'd be surprised, honestly, if it was 1%, because the bulk of the spend really is Google and Amazon and OpenAI, and they kind of like to have the occasional healthcare press release to make themselves feel good or something. But the vast majority of the money that Google makes is on advertisements, right? So where are they training their AI? They're training their AI to make sure that you still use Google search, because that makes them money. And so I think that you're right, is the cost worth it? But I would sort of argue that we're probably not spending enough on healthcare to really see if we can meet those promises that we'd like to.
Okay, I might say a few controversial things. I think those are really, the human side is often forgotten, and I don't think we can forget the human side. The challenge that we have is, let's talk about the human side. If we take a look at ChartWatch, the thing that we developed, and we take a look at a measure called recall or sensitivity, how many of the deaths does it capture? When we take a look at humans, so expert doctors, we've done this on over 3,000 clinician predictions, so that's our kind of data source. Their recall is about 31%. The AI is close to 80. So do I want more humans, or do I want an AI? One would argue an AI, right? Is the AI going to be able to hold somebody's hand and make them feel better? No. So I want humans. I think we have to start picking our battles, because I think on certain things, most clinicians are stretched silly, like they have way too much to do. You're probably working the equivalent of 3 people. Let's focus on the things that you really don't need to spend that much time on, or you shouldn't be. Let the AI take care of it, and let you focus more on the patient, the human side, that the AI simply can't do. I think we need to do a better job of that. The one other thing I'll say is that we talk about, there's this whole rhetoric around AI is not going to replace people. The people who use AI will replace people who don't use AI. We're now entering into a phase where I think AI will replace people, because we're seeing it, right? The AI is getting actually pretty darn good. So are we seeing job cuts? Absolutely. We have an initiative at our hospital where we have a medical coding team that I think could be cut by at least 50%, but the unions won't allow it. And they're writing clauses now, many unions, around not using AI because they're threatened by it. So if the AI is going to be faster, better, cheaper, of course there's incentive to use it. But what we have to figure out is, where are we going to spend our time to provide value? And I think there's a lot that we can do. We just have to change our mindset a bit.
Yeah, I mean, this was definitely a focus on sustainability, so all the other things about AI probably came too short in our discussions. There's definitely a lot, and obviously in computer science we have a responsibility for training, and obviously we also are hugely affected. You just mentioned the coding team, right? So AI can now replace us, which is scary for us personally. Yeah, that is definitely a different component where I think we again have to work very early in our education system that we integrate these ethics aspects, etc., more into everything integrated into our education plan that people are aware. But you know, these disruptive technologies have come in the past and have changed how our societies worked. And how they functioned, and AI will definitely be a huge disruptor in many different aspects. And yeah, I have no idea how this will work, but I agree. I think if AI allows us to do really cool stuff that we cannot do as good as they are, then we would have the potential as a society to spend our capacity on something else. The question is, will this produce money? Because that seems to drive that we all have jobs.
Yeah, I mean, you mentioned AI Scribe, which I think is, you know, an interesting example. Certainly as a patient, I would, to Mohammed's point, like I'd rather go into the doctor's office and have them look at me than their computer. And I'm old enough to still remember when medicine was that. Instead of people staring at Epic and maybe swearing at Epic as they go through the patient visit. And so, you know, but Scribe is such a good example because I've tried as an AI person to find out what it actually is, and I have no idea. I don't know if it's a skin on OpenL, on ChatGPT, on Claude, on something they built in-house. And so I couldn't begin to tell you the carbon cost or the accuracy because Scribe is not scientific or open.
All right. First, at least from my perspective, I don't know, just ballparking it, I don't think the ROI is there. There's a ton of money being put into it, and I'd say the vast majority of things that we're creating aren't going to work well. In fact, even the AI scribes, some of the companies have terrible products and others have good products. So yeah, it's tricky. I think we may get there at some point, but right now there's such a hype and such a rush that everybody's creating stuff, a lot of it doesn't work. The second question around, do we all just give it to Google? I hope not. I think what's going to happen with a lot of healthcare centers is they're going to be a hybrid model where they're going to be much smarter about how they buy solutions, where they tell vendors, you don't get to keep the data. These are on my terms. I get to get your output. I get your data, the data that you're using that's mine.
Isn't the value of having the data in one place instead of everybody holding it?
Yeah, the only problem with that is when you actually have vendors and you want to integrate solutions, vendors don't play together well. So to realize a lot of value, a lot of these things have to be integrated. So I think there's going to be a hybrid model in many hospitals to say, I've got some compute environment, I'm going to buy stuff from vendors, but I'm going to negotiate with them in a smart way. And that integration I can do if I want to, without really having being at the beck and call of the vendors.
So I think one problem is also data privacy here, so one has to be really careful with the hotels. I have tried to work and collect data, and it's basically impossible. So there's a lot of privacy laws that play a role, also putting data into the models, etc. And then obviously it's sovereignty. So you want to put this into Mexico. I think the individual governments will be very careful of doing this at the provincial, at the national level, and not outside. So there's also some limitations there. But I believe from a technology point of view, and also we have so many, that is a kind of how the tech companies work. It's all crazy small startups with crazy ideas, and 99% will go down and 1% will make it. That's a common model that we have. And I think this will be this is how it works. And that might be different than in other domains that I'm not familiar with, but I'm not surprised that I see it. But with this, a lot of, and the best ones will survive, I think, I hope. And so there are some technical issues with this, but I think some of the things can be overcome. They are not particular technical problems. They are more, again, problems of political issues or legislative issues that might play a role here.
Yeah, I think they're two good points. So absolutely, we're at the, if you remember the standard hype cycle, we're definitely, high up there somewhere. And we'll come down, but then we'll go back up and we'll accomplish a lot of real things. AI has been through this before. There was a huge boom and bust of AI in the 90s, and then a winter of zero funding that Hinton magically survived through sheer force of will. And so, in the second question, yeah, I agree with Mohammed. God, I hope not. I think if we give all of the data and all of the power, et cetera, to Microsoft and Google and all of these companies, it will just end badly for us all. And so we really need to keep the data within the hospitals in a more of a non-for-profit building kind of technology to help Canadians sort of way, as opposed to just, we'll let all these giant trillion-dollar companies do it and hope that they don't charge us $1 trillion in exchange.